Okay, so today I am joined by the most awesome Laura Williams, who is she's brilliant. She's brilliant. And when she comes on camera and starts talking, you realise how vibrant and lively she is, and just what an awesome person she is. And we're kind of here to talk about sepsis, kind of Sepsis Awareness Month, which is September 2020, which is where we are at the moment. And this video will be released on World Sepsis Day, which is the 13th, and Laura will correct me on that if I'm wrong. But I'm going to get Laura to tell us an amazing story about her sepsis journey. Laura is a podiatrist. She's an educator. She's a blogger. She does social media, and she is, and this is probably the most important thing, is that she is a sepsis survivor, and she's been through this absolutely horrendous experience of, when you're a healthcare professional, being a patient, it's hard work, but going through a horrendous experience which potentially could kill you, and then coming out the other end and turning it into something really positive. So I'm absolutely stoked that Laura's come on to talk today, because it's breaking my seal of YouTube videos. I haven't done one for a while, and we talked about this ages ago. So Laura, thank you. I'm really looking forward to this.
Hi there.
How you doing?
Really good. I've been really looking forward to doing this as well because we've been talking about it for months. Or was
Yeah,
it even last year at the Foot and Ankle show?
yeah, yeah. It has been a while. Has been a while.
Yeah, when you were using my head as an armrest.
Well, if you're going to be about the right height for that, then that's not my fault. I mean, I just took it as an opportunity.
Yeah.
It was a good thing. It was a good thing, definitely. It was a good thing.
it, it was a fun day.
So, question for you: when did you become a podiatrist?
I graduated 5 years ago from Brighton. Um, but that was actually a really difficult journey for me because I actually didn't learn to read till I was 13. I don't know if you know this part.
No,
Um,
I'm getting more interesting bits of stories as we go along. It's a
yeah.
tease thing, isn't it? You tell me a bit, and then you bring back bits later on.
Yeah, so basically what happened was because I'm hard of hearing, I didn't learn to read till I was 13. But then it meant that I didn't get an English GCSE, did really badly in my GCSEs, went and did my all I'd wanted. And do you know what? I'd actually, when I was in school, I was like, all I want to do is be a nurse. And I was like, I'm going to do an MVQ in care because I started with a GMVQ and it was too, at the time, it was too heavy for me because I remember reading my English GCSE exam and the words were coming that slow. So as you can imagine, didn't get very far. So I got an E first time round. But I went to, after I left school, I went to do an MVQ in care. And halfway through that, in my level 2, I met a girl and she was actually doing an MVQ in beauty and massage therapy. So and she got me really into that kind of stuff. And so I then actually left, became a beauty and massage therapist, traveled around the world. And then in 2010, at the end of the year, came home and actually had got the experience then and I'd learned to read by that point. Woo!
Awesome.
And so I contacted Brighton University and I said, right, I've got an MVQ in care. No, sorry, I've got an MVQ level 2 and 3 in beauty therapy. But they were saying because I'd been out of education for 5 years and I didn't have my English GCSE, I needed to go back. So I did an access course and I did an English equivalence qualification. Only a few weeks before did we find out that the English equivalence qualification that I did wasn't accepted by Brighton Uni. So I then had to do another year while working, and went to night school and did an English GCSE. Best thing ever, because it was I went into the best year. They were just so amazing, like some of the best friends I've ever made, you know. And so basically it took me 5 years to get my degree. And at the end of my degree, the funny thing is, all I had thought was, I want to do education. And I actually applied for a job to teach about diabetes. I got it. And to do a peer pressure, I actually decided, no, I've worked too hard on podiatry, so I'm going to go back to podiatry, even though I got that job. My aim at the time was actually to eventually work with WHO and to do with diabetes. That's changed a little now.
Only a bit.
Just a wee bit.
Just a tiny bit. Just a tiny bit.
It's amazing what personal experience can do.
Yeah, it's interesting. It's interesting, and actually, what I want to quickly touch on there is that your story of podiatry not being the first thing that you got into is not an unusual story. And I think if we look at the stats, and somebody with more brain and more brain power than me will correct me on this one, but I'm sure that the average age of a podiatrist at the moment, or that the average age is 45 to 54. So we're very much, as a profession, an older profession, and most people tend to get into it after doing some other stuff, like a bit of life experience, or faffing around doing something else, or nursing, or beauty, or all kinds of things. Army, insurance, there's so many different things. I was reading something about a podiatric surgeon, Felix, I think it is, who was trained partly with the SAS when he was in the forces, and now is a podiatric surgeon. So it's not a never, well, to say never, it's rarely a direct route into podiatry.
Really rare.
But that education thing, I really resonate with that, because that for me is a big thing as well. That it's how do you help more people? Education's a big thing. So yeah.
Yeah, and both my parents were teachers, so
Ooh, bad luck, eh?
yeah, my dad was a head teacher of a
Oh,
bilingual primary.
wasn't a geography teacher, was he, before that?
No, he actually started off teaching in secondary with my mum in Edgbaston. And he was science and PE originally, and then after 10 years of teaching secondary, of being teased for his Welsh accent, because his first language was Welsh, and he actually had to translate everything in his head before actually it then coming out, because not first language. He learned English at the age of 12. So it's like, but he knew that he was bilingual the day that he had a dream in English. And it's really weird that you don't actually associate dreaming in a language.
Yeah, that's true. So you'd have to translate from Welsh into English and then into Brummie as well.
Yeah, but this is the thing. He wouldn't actually translate into Brummie. He'd just do it in a very Welsh accent. But a slow Welsh accent.
Oh, love it. Love it.
And so I've always understood the value of education, but it was the fact that I always got really frustrated. And so when it comes to my main story now, it's all to do with sepsis, obviously. And I actually remember the day after having life-saving surgery, I don't know if I told you this, I was writing down all the stuff that happened that I remembered the day before to write a blog about it.
Interesting.
While still in hospital.
Well, actually, that's interesting because there was a very big change. As soon as the sepsis happened and the recovery happened, it was like something was switched on.
Yeah.
It was almost like, I know, the stars aligned, or the jigsaw piece, last piece of the jigsaw came in, but everything kind of changed completely for you. And the question which always floats through my head at this point is, why is it that something which is almost life ending has to be the catalyst to change stuff? Why can't we just go, actually, that'd be a really good idea to do that, I'm going to do it? Why do we have to almost die or have something really very, very bad happen in order to act? I mean, that's a whole discussion on its own. But
Yeah, and
I
I
remember
think,
there was a big change. There was a big change in you from kind of pre-sepsis
yeah, and I
to
think Jill
post-sepsis.
Wood saw that as well.
Mm.
I think, but for me, I think it was like, I've been like, I want to see about writing a book, which I'm still doing, but it's on the back burner. But it's basically like, I remember actually, all right, I actually need to get into the story to actually then actually
Come on, come
say.
on! Don't keep everyone waiting. I want the story, girl. Come on.
Okay, so basically, my story starts on the 3rd of Feb, 2019, and it was a Sunday. No one ever wants to work on a Sunday, but I was. I went to a nursing home, and begrudgingly, I was treating patients. But I was walking down the corridor. I think I was singing to myself, which is a very common occurrence, or used to be. And one of my favourite patients, who obviously for patient confidentiality reasons we're not going to name, however, we're going to actually give her a different name, and so we're going to call her Joan, because it's always actually nicer to actually have a name, but obviously not hers. So she saw me. She was like, "Oh my God, Laura, so lovely to see you. Can I have a hug?" And when it comes to working in healthcare, you kind of have to have the whole humanity side behind you. And so you kind of just be like, "Oh, yeah." And a hug always feels good, right?
Yeah.
So
Yep.
for them and for you. And so it's like, "Oh, yeah, well, that's so nice." And went off feeling all gooey afterwards. And with me being dyslexic as well, which is something that they found out when I was in my second year at uni, because I almost failed my first year. That's another thing I didn't say. I had 60 credits to make up over the summer, and I was the only one who managed to get back into year 2. Yeah. So what was I just saying?
Joan, hugs.
Hugs.
She hugged you. You
Oh,
felt gooey. And then dyslexia, but Joan didn't cause dyslexia because
no.
that would be bad to accuse Joan of
Yeah,
dyslexia.
I
Why is she
actually know
called
where I'm
Joan?
going now.
Joan's
Because
just like an old person's name. You need to change it to something more. I don't know. Not Mary. That's even older. But anyway.
no, I now know why I was saying dyslexia. It's basically because when I'm tired, my dyslexia kicks in, so it takes me a hell of a long time to write my notes. That's what I was saying.
Got you.
Right.
Got you. Okay.
And so at 7 o'clock, I was still writing my notes. And at 7 o'clock, I then saw her being wheeled out in an ambulance. And
Ooh.
I was like, what's going on? Is she all right? Basically, because I was like, no, you can't have one of my favorites going. She didn't make it, but she actually, I know, she had uncontrollable sickness and diarrhea.
Oh.
And what was my first thought? Oh, beep. I gave her a hug earlier. So I thought nothing of it. And then 2 days later, on the Tuesday, so the 5th, I woke up with sickness and diarrhea
Ooh.
and toothache in my right side.
Ooh.
And so it's like, great, I've got that off my patient. And then I've got a toothache as well. And so it was like, awesome. And so I was phoned in work, can't come in, sickness and diarrhea. So, like, great. And I was in bed on the Tuesday and the Wednesday. I was feeling really gross. The dentist had said I can't come in until I'm 48 hours clear of sickness and diarrhea. And the doctor said, if it gets worse, just give us a shout. So the Thursday. This is where things get interesting. And we hear about patient deterioration. Like, we deal with things like cellulitis and stuff like that all the time with podiatry, and ascending cellulitis and all of that. Yeah. Well, I woke up with no neck.
Oh.
Literally, my throat was out here. I looked like a hamster.
Shouldn't laugh at that, really, should I? But yeah, I've just got this vision now. Yeah. Yeah.
Yeah, so I looked like a hamster. I was finding it difficult to breathe.
Oops.
Yeah. My temperature wasn't excessively high. My blood pressure wasn't excessively low. I was in a lot of pain. Could hardly talk. And, well, as you know, I can talk for Britain.
Yeah. So if you couldn't talk, you must have been unwell.
About 10 words in that entire day.
Wow.
Yeah, because it was that painful.
Oh.
Really fast breathing. Rigor to the point where I looked like I was having a fit. And hallucinations. But me being the most typical healthcare professional that you can get, I didn't want to cause any extra work for the NHS. So
Oh,
I was like, I'm not going to go to A&E. I'm going to go to the doctors.
that's so healthcare.
It
That's so,
is, isn't it?
do you know it is a thing. Anyone who is a healthcare professional watching this will know that feeling of, well, maybe my 40-degree temperature isn't that bad, and maybe the fact that I've got an extra joint in my leg is okay. I'll be fine. I'll be fine. Or if you've got kids, it's, are you dying? No. Then we're fine. Just take a couple of paracetamol and you'll be okay. Or so
Yeah.
it's a thing. It's definitely a thing.
Yeah. Basically, you're not wanting to be a pain in the ass.
Yeah, absolutely. Because you appreciate the opposite side of the coin, and I'm not saying for a moment, being an ex A&E nurse that patients are a pain in the ass, because everyone is there because they feel they need to be there, but you get to triage everyone. You get to look at the whole spectrum of people who are really unwell and people who are swinging the lead. And even if you're really unwell, you don't want to be that healthcare person who goes into hospital who might be seen as swinging the lead. So yeah,
Yeah.
it's a very, very particular thing.
Yeah. So, because I'd woken up at 6:30 and was like, right, I'm going to wait 2 hours. At 8:30, I'm going to phone the doctors. I phoned the doctors at 8:30, hearing, we're very sorry, the doctors are shut today due to training. It's what you call the classic not getting enough oxygen to your brain, so you start being confused and hallucinating.
Yep.
But one of the big things is I'm asymptomatic as well. So the fact that my temperature wasn't excessively high, my blood pressure wasn't excessively low, my O2 sats weren't really low at that particular point, means that, not quite on the border of sepsis.
You hadn't quite reached that drop off cliff.
Yeah.
Adults tend to be a bit sort of, they get unwell and then they kind of do this and they drop a little bit. Kids just go bump and drop really quick.
Yeah.
So yeah, you were just at that point where your symptoms weren't quite fitting into the category of oh shit, I'm not well. They were just, or oh shit, I'm really unwell. It was just, I'm not too well.
Yeah, I was climbing the mountain at that point.
Yeah.
So I then said to my mum, the doctors are shut. She went, no, they're bloody not. I've got you in 20 minutes. So my mum took me to the doctors and he was like, I can see something's not right, but I'm not a mouth specialist. You need to get an emergency appointment with the dentist. Personally, I think he should have basically said, go to A&E, but that's the, swings and roundabouts.
You make a decision at the time based on the information you have and your intuition, and your intuition is essentially your experience and pattern recognition. So yeah, but it's a good learning point. It's always a good learning point. And I'm sure as a healthcare professional, I'm sure the number of times I've stuffed up or haven't acted is quite numerous.
But the funny thing is, when I'll actually tell you about when I got to the hospital, actually a week after I'd been discharged, I was speaking to Clara, who was my Max Fax specialist, and she had said she'd only ever seen my case of sepsis in a textbook. That's how rare it was.
Wow.
So I don't actually blame the doctor.
Well, they could have at least bought that textbook.
Exactly.
Maybe that's the thing. Maybe you need to find out which textbook it is and send it them as a Christmas present.
Nice.
A little photo of you in there as a bookmark.
Yeah. So but one thing he did do is he was like, with the fact that something's not right, here's some amoxicillin. He did do that good. So we got out, we phoned the dentist and managed to get an appointment within an hour. So in that time, we'd already got amoxicillin. I'd taken one of the amoxicillin and we sat on the dentist chair within an hour. And after 2 minutes, she said, I don't want to scare you, but you need IV antibiotics now. She knew what I did for a living. So she knew that I would have been freaking out right at this point.
Yeah. Yep.
So this is actually makes me actually think that we need to be more aware when we're actually saying that kind of thing. But I was like, okay, cool. But I remember coming out of the dentist's office and I actually had 20 quid in my hand because I'm lucky enough to be an NHS dentist, to actually pay the receptionists. And literally, there were 5 of them there. All of them went, go. Like, yeah, go. Oh, okay. And basically, my mum had to pull me. And so it was like, right, okay. Got into the car. My mum phoned my dad and was like, right, okay, you need to get pajamas, phone charger, and we'll be home in 10 minutes. But it ended up being 7 because mum was like, and my dad had to take us. It's basically because at the moment, even now, Royal Sussex County Hospital are basically building an entire hospital on the site of the hospital.
Yeah.
Because
is Royal Sussex the bottom end of Brighton, or is it the one by the race?
The bottom end. The bottom end. The one on the hill is the general.
That's right. I know the. I know. Well, I lived in Brighton for 6 months where I started my nurse training. But so the Royal Sussex. I mean, the parking around there is shocking anyway at the best of times. So
the car park was shut.
Ah, okay.
So yeah, that was fun. So my dad literally got there, bearing in mind we were in Hove, so on the other side of Brighton, we got there within 10 minutes. So my dad was like, I think he kind of probably went double the speed limit every single which way. And one of the things I now remember is the dentist asking, are you going to Worthing or are you going to Brighton? And we said Brighton. Because where the MaxFax team is, they are on the other side. They're not in the main part of the hospital. They're actually outside of the hospital on the other side of the road. And they were with the triage within 30 seconds. So we think that they ran through.
Yeah, yeah, which makes sense. Definitely makes sense.
Yeah. But there were 44 people in A&E, and I was in within 2 minutes. Which just shows you're sick.
Oh yeah, yeah. If you come straight, and they probably. So if because you got taken in by your mum and your dad, if you'd have come in via ambulance, they probably would have been a red phone call. There would have been an emergency phone call coming in, and they would have prepped resus for you. But because you came in probably that way, and actually it would have been quicker getting you in with your mum and dad anyway, probably given.
Yeah, they actually said if I'd waited for the ambulance, I wouldn't be here.
Yeah.
They actually, in recovery, they said that if they'd waited for the ambulance, I wouldn't be alive right now.
Yeah.
Which is really scary. Yeah, so I got into triage. Within about 30 seconds to a minute, MaxFax were in with triage. About 5 minutes later, I'd had an x-ray because although the x-ray department was absolutely full, went in first. And they did an x-ray of my jaw. It took about 5 minutes to walk down that one corridor because I had absolutely no energy. And as soon as we got back into minors, IV, they'd taken my bloods and they were like, yeah, you've not got enough energy to walk down to majors. So they got me in a wheelchair. And so immediately, because they'd already got the IV, I was attached to antibiotics, fluids, steroids, you name it. Had O2 sats, which were down to 89. which is impressive.
It's still manageable on 89, but not the ideal place to be.
Yeah, but ideal is like 9900, really. But
Either better. Either better.
sepsis is anything below 95. So, hey. Um, so hence I was really confused. uh, Oxygen mask, like my blood pressure was, they literally had it on me, so it was constantly taking it. My temperature was quite high. I think it was 38.5. But I remember actually having the whole thing. Like, one of the big things is a feeling of impending doom. And I actually didn't really have impending doom. I had a feeling of acceptance where I was like, yeah, I'd be okay if I went now. Which, nope. I got too much to do. And so I was on a bed for 5.5 hours. Right. So that was me. The big thing with that was ice, because I had to have an MRI. Well, usually people have an MRI, but I couldn't, because I have a bone anchored hearing aid.
Yep.
So I had to have a CT scan.
Yep.
And one of the things that happens when it comes to sepsis is blood kind of leaks out of the arteries and the veins. So that was what happened.
Oh, bruisey.
Yeah, but it was actually all to do it. That was actually, there was the bruise here, but that was all the irritation from the dye. And it was like that for about 3 months. But that glove was hot within 5 minutes.
Were they basically using you to keep water warm because the kettle wasn't working? Was that?
Probably.
Yeah. Oh, she's fine. Look, she's got a fever. She's pyrexic. Let's just get her to heat the water for us. Come on, Laura. I need a cup of tea. I'm back on shift in a moment.
Yeah, basically. And then 5 minutes later, I was taken down to surgery. With surgery, I actually had to have two anaesthetists, not just the one. Because when it comes to intubation, usually, as you know, it goes down the throat. My throat was too swollen. Had to go down my nose.
Oh.
While I was awake.
You're a very lucky girl.
Yeah. So, local anaesthetic up my nose. And then a new IV port on the other side for the general. And by that point, I had actually said, I'm a pincushion. And I can give a local anaesthetic, but come near me with any needles and I am not good. I actually remember as a child, the nurse in my practice in Llandudno chased me round the room to do my NMR. Chased me. Yeah, is what. But apparently, 95% of all premature babies have a fear of needles as they grow up, and that was me. So that was fun. um,
So they
I
managed to
kind
put
of got
you to sleep anyway. They managed to get
yeah,
you to sleep.
yeah. It took me 20 minutes.
Okay. Yeah.
Because it was a little bit here, a little bit there, a little bit here, a little bit there. And then I woke up and I was Frankenstein's monster crossed with a hamster.
It's a good look.
It really was. I had a drain here and a drain here. Um, Bleeding from the mouth inside because they also had to take 3 teeth out on the bottom. So I had to learn to eat again. Then, yeah, so don't look very well. That was taken the day after. That was, I think, my 3rd redressing. And then that was one that I did at home. And yes, I did.
Well, you should hope so. You've got dressing skills. You should be able to manage that.
Exactly. However, when 9 days after doing my dressings every 4 hours because I was just leaking, I went in and they told me off. Yeah, so I was really lucky. I was only in for 4 days, but my pulse, thanks to my Fitbit, told me that I was 169 beats per minute.
Wow.
Yeah, they and a whole load of stuff that people don't talk about. Because I know that I don't think you'd actually heard of it before I talked about it, was post-sepsis syndrome.
No, I hadn't. I hadn't. That was really an interesting thing. But it kind of makes sense, doesn't it? You know,
Yeah,
there's so many post things. There's post-traumatic stress disorder. There's post-polio syndrome. There's so many things which happen after an event which are associated with the event, and it kind of makes sense.
yeah. So with the fact that 30 million people each year have sepsis, 11 million people die of sepsis, which means that 1 in 5 deaths worldwide are to do with sepsis.
Wow.
That was actually by the Lancet earlier on this year. So it means that 19 million people survive each year. So that's really positive that 19 million survive out of the 30 million. But it's preventable. So we want that to be 30 million of that 30 million.
Because sepsis became a thing, didn't it? It was something which, well, yeah, when I was nursing, there was no such thing as sepsis or no such label as sepsis. It was septicemia. That's what, and septicemia was this end point of a cascade of really crap things going on, which generally resulted in death.
Yeah,
Sepsis
but the
is
thing
kind of
is,
Sepsis is
what,
just a different way of describing it, but it's always been there. We just now
yeah,
know how to categorize it and the signs and symptoms and what to watch out for.
but the thing is, septicemia is different to sepsis. And this is the big thing that a lot of people don't understand, because septicemia is blood poisoning. However, sepsis is the effects of that.
Yeah, yeah,
So it's to do with the kidneys failing, it's to do with like your body completely shutting down
yeah.
because of the inflammatory response. And so a lot of people get that wrong, and that includes doctors. But when it comes to it, out of those 19 million that survive, 7.6 million have lasting effects, and this is post-sepsis syndrome. So 7.6 million, that's a shitloads of people.
It is. It is.
And this isn't just physical, it's psychological as well. And it's actually one of the reasons why I've kind of stepped away from podiatry at the moment. Is, who knows, I might go back to it. But for me, at the moment, whenever I'm wearing the face mask, I'm getting flashbacks. And that is of having an oxygen mask on, which was definitely needed because my O2 sats were so low.
So let's put that into context, because I think that's a really important thing to kind of highlight, that we have a profession that you have fought through, you know, educational challenges to get through and qualify, a profession which you absolutely love and adore, which now you won't do, or you won't do at the moment, because wearing a mask, which, you know, with COVID going on at the moment, everyone has to be wearing a mask. Go to the supermarket and wear a mask. It causes you significant kind of psychological trauma that actually, when you've got to weigh it up and go, can I deal with that and work as a podiatrist or not? That you are having a change in direction and change in career. And that goes to show the power of that kind of psychological, the power of the effects of going through sepsis, the flashbacks. And I think it's a really important bit to highlight, because that's something which, you know, you deal with the sepsis. Here we go. We've sorted your sepsis out. We've taken your 3 teeth out. We've made you better. Bye. Off you go. But dealing with all the stuff which happens afterwards, the changes to your life, the changes to how you react to things and how you respond. And if, you know, hospital, you go back to hospital again in the future for something fairly major, what's that going to be like? I think it's a really, really important kind of underlining point.
Like, and you saying that, like, me and my other half, we've talked about, like, at some point actually wanting kids. But with the fact that sepsis and childbirth is very, very common, it's a lot more common than people think. And it is something that's in my brain now.
Yeah. Yeah.
And I've got a very good friend, Mimi, who had sepsis, like last year. Like, one of my friends, Kat, she actually trained with me in my year 1. She had sepsis. One of my other friends, she had sepsis, all in the last year giving birth. And one of my boyfriend's best friend's wife, 4 in 1 year.
Wow. That's a lot.
Yeah. And it's things that you don't hear about.
And it's interesting, you know, okay, 3 children here. With, you know, my wife, she had 3 cesareans. I don't recall at any point. Okay, we're talking, you know, the last child 10 years ago, but we're talking, there was no really kind of big highlight around, well, actually, this risk of sepsis, or whatever they would use to refer it to in terms of, you know, a post kind of procedure infection was never really talked about, never mentioned. I'm sure that they would have had infection as a general kind of qualifier on a consent form, but nothing to kind of show the severity of it, or the frequency of it.
Yeah. But 4 friends in a year.
Wow.
Yeah, it's crazy. But the thing is, you have like so much other stuff that's going on. Like, you know, with the fact that I was saying about panic, the flashbacks, with that, and then also getting anxiety and stress, because I'm like, what if I have another panic attack? You've then got something that was horrendous at the beginning, was short-term memory loss. And what's the one thing as a podiatrist we need to do?
Have a good memory.
Yeah, because we need to write our notes.
Yeah.
And so, and also nightmares are a massive thing. One of my friends who was on my podcast, he was the second person, his name's Mike. he had sepsis a year and a half ago, or 2 years ago, something like that. And every single night since, he has had nightmares.
Oh.
And so, as you can imagine, with that, and I get them quite often, it means that you're knackered. You're then getting brain fog to go with the short-term memory. You're not wanting to go to sleep, so you've got massive insomnia, because every time that you're going to sleep, you're having all of these symptoms. And literally everything is kind of like a triad. You've got the one, which then you've got the nightmares, which means that you don't want to go to sleep, which then means that you're trying to put it off. So you're then having the insomnia, which are then giving you the brain fog, which is then causing the short-term memory loss. It's a massive thing. But then all of that is then causing massive fatigue when it comes to your body.
Yeah.
You're falling asleep in the day, like you've got massive muscle weakness. Do you know what? The one thing that was really annoying me afterwards, and I know it sounds really, really weird, change of taste. I went off my cup of tea for 3 months.
What is wrong with you?
I know.
Yeah, you treat tea with such a lack of respect.
I tried. It was like,
Goodness me, I brought you on here for a conversation. Are you talking about tea like that? What kind of conversation's this?
but literally, I went off tea. I went off chocolate.
Oh my God, this gets worse.
Yeah, it really does. But I've become more of a savoury person now. But then you kind of get really bad joint pain. Like I remember actually, I was saying about the not wanting to go to sleep.
Mm.
But during the day, I'd get to the point where I was so knackered from actually writing my notes. I'd then be like, I need to sleep. So I lived 1.5 miles away, 2 miles away from home. I had to sleep on the way home in the car.
Wow.
I had to stop the car for an hour to have a sleep. I then would have such heavy joints because of the fatigue that I actually would call it lead legs, because I'd actually managed to get home and then I wouldn't actually be able to move my legs because they would feel like lead.
Yeah.
But the funny one, I know that I was saying when I got told off by the nurse for not coming and all of this. This is the bit that you were really excited about me saying.
Well, I kind of yeah. I mean, when people hear the story, people have heard this story before. I'm sure if they've heard your story, but one of the things throughout the whole of your kind of journey and your story is that you've maintained a sense of humour about it.
Yeah.
And I knew that when we were chatting about this, that I could say to you, I suddenly thought, oh, this would be a good thing to say, knowing that it would resonate with you, and yeah. So I'll let you go on, tell this, go on, tell, say, oh, we've started you off now, haven't we?
You have.
Ladies and gentlemen, watch Laura as she has a hot flush moment.
Right. So when after I'd had the drains out, I said that I had to change my dressings every 4 hours. And so after the 9 days, I changed. The nurse was like, "No, you can't have it anymore." And I'm like, "Okay, that's fine." But I was saying I need to have an Inco sheet on my pillow because otherwise, ew.
Sexy.
Yeah. And I just remember, because I was still looking like a hamster, This one day I yawned, right? So basically, I just got dressed and I had to change my entire outfit because I had Niagara Falls down my outfit and completely dripping wet. So, what did I have, Dave?
Well, you had chin continence. Now that is the portmanteau of portmanteaus. That is the it was the way you described it. Inco sheet, which is for incontinence, and then it came from your chin continence. It was a given. It was a barn door opportunity to bring the two words together, and I wasn't going to miss it.
No, and the nurse at Hillrom that I was speaking to 2 weeks ago was like, "Oh my god, that's epic! I
You're
need
welcome.
to remember that."
You're welcome. My
And,
job is done. If I achieve nothing else in this life, my job is done.
and yes, so for about a year, I was at the point where I was having more or less burnout because I was so knackered from all of this. Because I went back to work 2 weeks after coming out of hospital, way too soon. However, I will say the fact that we deal with nail dust and all of that kind of stuff meant that I was like, I don't want an open wound near that. So I put meeple over my chin for when I was working. And it actually brought up the conversation of infection to every single one of my patients. And it was like, right, okay. So actually talking to them about sepsis and talking to them about infection and like cardinal signs and all of this kind of stuff, and they were like, "Oh, okay, then, cool." And for me, furlough came at the perfect time
Yeah.
because I was at the point where I probably would have had full on burnout. And oh god, since I was home, I was like, right, okay. For the first few weeks, it was like, okay, I need to find stuff to do. And then it's like, you know what? I'm going to start a YouTube channel. And so, sepsis education, educating healthcare professionals on the dangers of sepsis and its aftermath. And the first video was actually saying how sepsis changed my practice as a podiatrist, and it really did. I remember talking about how, although before I was like empathetic, sympathetic, if there was something like that happened, it would be in my brain constantly. Like, I remember the first time I had someone with a nail infection after, and it was like, no, that's not good, and like drawing around with a marker and all of this, and I was like, just keep an eye on that. If it goes further than that, but get some antibiotics now, but just, and they were like, right, cool. And I phoned her up 2 days later just to make sure that she was okay. And it was because she'd been in my brain and I couldn't let it go.
Yeah. Yeah.
And I remember I also had someone who was newly diagnosed with cancer. And I was like, so how are you feeling? She's like, oh, I'm fine. And it was the fact I was like, right, okay, I'm going to wait, not next appointment, the appointment after, because it will have kicked in by then. She'll have. And it's because by that point, I was very much, okay, I know where things are kind of going when it comes to mental health, like shock and things like that. And it really changed the way that I looked after my patients. And I was like, right, okay, so that was all right. And then I was like, I'm going to do something on post-septic syndrome because there's not much out there. And the one big thing with my YouTube videos, I don't really edit. I just go straight through. And if I fudge it, that's it. But I don't care. I'm like, you know what? That's fine. And I think it actually works because a lot of people have said that they do find that I've been helping a lot with that. And I had one person contact me and was like, Laura, I thought I was going mad. I'm so glad that you said exactly what you said because it meant that I'm not going crazy like I thought I was. And I was like, yeah, don't worry. I thought I was going crazy. Like my doctor didn't believe that I had sepsis when I went back. It was a different doctor. But it was the fact that it was about 4 months after and I had all but 3 symptoms of post-sepsis syndrome. And I went in and I was like, I'm really struggling with my mental health. I am really struggling with all but 3 symptoms. Basically, the only ones that I hadn't got were acute kidney injury, and there was another one, and neuropathy. Actually, no, it was 2, not 3. Because although I wasn't having hair falling out, it completely changed. Hence, it's curly now. It never used to be. And I know that I'm very lucky because I've got lots of friends who've had amputations and like gangrenous kind of joints. And I know that I'm very lucky. And the good thing is I'm actually now very good friends with my A&E doctor. And she's just amazing. But I know that if it wasn't for A&E, I wouldn't be here. And I know that if it wasn't for my mum and dad, I wouldn't be here.
I just want to touch on something which I think is really important. And it's one of the things which I think as healthcare professionals, especially healthcare professionals who maybe work in a private business, they don't utilise their own experience. And the power of your experience is, we almost think it's something separate to kind of our work life. But, you talk about having the me fix and the patient's going, oh, what's that for? And you can talk about infection. You can actually educate people because you've made that connection, and that connection helps so many people. And I think we really have to underline that, and we have to highlight that your experience and your story and what happened to you has the ability to help so many other people.
Yeah, and with that as well, it's also trust your instincts. Because when it comes to it, I'm actually helping the Nursing Times and Hillrom with a webinar next week, which is working with Sepsis UK Trust. And it's on deteriorating patients. And you may not have somebody who fits all the criteria, as in temperature either below 36 or above 38.2, really low blood pressure, below 95 when it comes to your oxygen levels in your blood, extreme pain, fast breathing, massive shaking, like impending doom, confusion, like feeling, having like either pale or jaundice or a rash or hallucinations. You may not have all of them, but if you don't, even if you don't like fit the criteria, if you know something's right, something's not right, and you know your patient, you have to trust your instincts. And if you know something's not right, you need to push it.
Yeah, you have to be an advocate for your patient. You know, 100%. And I think I think having worked in, you know, as a nurse in various healthcare places and as a podiatrist in various healthcare places, certainly the experience I've had at being able to be an advocate for your patient, but able to do it successfully, probably for me was A&E, because there was an understanding that whatever you kind of spotted and said, I think this is a problem, it was taken seriously. You'd have that discussion, and it may be that nothing needed to be done, but at least somebody would actually listen and work it through with you. And if you wanted someone to come and see the patient, they'd do it. Or if you needed something prescribing, they would do it, because they listen to the experience and that intuition. So yeah, I mean, there's a lot for me around how you monitor your patients and how you know your patients. And you know, on a ward environment as a nurse, everything's so fast paced now. How easy is it to get caught up with so many jobs that you can't monitor patients in quite the same way, and that subtle sign gets missed a little bit.
Yeah, and one of the big things is the respiratory rate that does that as well.
Yeah, our respiratory rate, 100%. We used to monitor that all the time, and even when I've had
Yeah,
patients in, you know, who've come into podiatry clinics or surgery who've maybe had a little bit of a vasovagal or fainted, respiratory rate's one of the things that I've always recorded. And it's not something which is routinely probably taught outside of medicine and nursing. It's something which seems very much to be in that area.
yeah, but it's also the fact that people are often people go, oh, 15 seconds and times it by 4, but that's not the case. You shouldn't. It should be 1 full minute,
Yeah, yeah.
because a
Same
lot can
pulse.
happen.
Yeah,
Hmm?
absolutely. And also there's an element of when you're checking respiratory rates, there's a Hawthorne effect that people think, oh, I'm just checking your respiratory rate, and their breathing will change because of it. So the way we always used to do it is get the hand on their chest, and we would take their pulse, or you'd be feeling for their pulse. And they thought, we're just going to take your pulse, and actually what you were doing is you were feeling the movement of the wrist up and down on their chest to count their respiratory rate. So it was a little bit of sleight of hand, but it was the only way to make sure that you didn't get a change in respiratory rate because people were being observed.
Yeah, and it's very interesting. But it's actually, for me, I know that a lot of people would actually be like, it's the worst thing that's ever happened to me. Like, and although I'm having like, well, some people would say mental health crisis, but for me, I don't feel that. For me, it was the best thing that ever happened to me.
It's liberation.
Yeah, it was the best thing that ever happened to me, because I, well, I've changed as a person completely. I'm a lot more cautious. I don't have the zoomies anymore. Basically, Diane, as in Potty Purple Pod, she was nothing compared to me. I would be like, I was like a greyhound with the zoomies. And it's actually made me just be like, you know what, chill. It's made me a lot better and I'm feeling very lucky. And the funny thing was, I like, you know, when it comes to my podcast, I didn't think that I would do anything like that. And it was, in fact, I was like, you know what, I'm gonna listen to this. I'm not gonna do one, but I'm gonna listen, see what it's all about. By the end of the week, I was doing a podcast. And I think it was then that I started to actually process what had happened and what I'd been through, because I was able to speak to other people who'd been through the same.
That was your therapy.
Yeah, even though I'm going through therapy at the moment, it was the first time that I actually kind of opened up about it.
Well, it's that collectivity thing, isn't it? It's being around people who understand what you've been through, and then being able to share that experience and that story to help other people. And that's why your story is so amazing. That's why I love your story. And I remember watching it all kind of unfolding when it was happening and going, oh my God. And then I've watched what you've kind of done with it, and what really resonates to me there is when you say it was the best thing which ever happened. And it comes back to what I said earlier, is, you know, why is it we have to have a near death experience or something really seriously happen in order to make changes in our life which are essentially positive and take us in a direction which maybe we want to be going in. And also then we view that as the best thing which ever happened. It's a great question. It's a great question. But yeah, I love your story. I love your story, and there's some brilliant things happening. So for the people who've watched right the way through to this point, because they're probably on the second cup of tea, which is good. You talked about your podcast, which we can link to, and YouTube channel, which we can link to. Where can they find you if they want to have a conversation about sepsis?
Yeah, so I'm on Facebook. I'm on Instagram as Laura Williams Sepsis Educator. I have an online course which is called the Sepsis Essentials Blueprint, and that's talking about post-sepsis syndrome, sepsis 6, and what are the signs and symptoms of sepsis. And with that, I've then got a specialised group for people who have done the course, which you're in that group as well.
Yes, ma'am.
Basically because Dave was so amazing and actually was in my beta group. So he was part of my
shucks.
Pardon?
Shucks.
He was one of the.
It was brilliant, though. I mean, I remember going through the sepsis stuff with you, and I'm kind of embarrassed to say that even being a nurse previously, my knowledge, and maybe it's to be expected being a podiatrist at this point, my knowledge of sepsis and just the breadth of it was not as good as it should be. So yeah, so it was brilliant. Well worth checking out.
Yeah, no, I really did appreciate that, by the way. And it's because you had the other side, so you had the nursing side as well. That's why. So you know what, and the fact that with Dave, you know that Dave will be brutally honest if need be.
Yeah, sorry.
But you know I like that. And yeah, so it's been amazing, and I'm doing a lot of stuff with Sepsis UK Trust at the moment, and FEAT, which is FEAT, not FEET, which is the only sepsis charity that's to do with research. I'm also killing myself at the moment doing Cycle for Sepsis, which I'm doing 150 miles in the month.
Nice.
Bearing in mind, as a sepsis survivor, you get to the point where you're very fatigued very quickly. And I was at the point where beforehand I wasn't able to really walk a mile without having to relax. And I've gone 9 miles further than I thought I would have done by today, so that's good.
Cool.
Um, I am working with one of the sepsis World Sepsis Day ambassadors in the UK, and there's only two of them. Jess Tuffield, because she's doing something, a campaign that started last year, and it's called hashtag around the world in 13 days. So I've been doing a lot of stuff to do with that. I've been doing a lot of stuff to do with, I've been on 2 talk shows. I've been on a podcast that came out the other day, which is called The Family Doctor. Yeah, so it's been amazing. And all since being furloughed. And I think it was the best thing that actually happened to me. And a lot of people have been like, going crazy with lockdown. For me, I found it the best thing because it actually gave me purpose, and I found out where I'm meant to be. And so next week as well, I am helping Sepsis UK Trust, Hill Rom, and the Nursing Times. And I am basically patient expert who's a different healthcare professional with a webinar that they're doing. It's going to be global, on deteriorating patients.
You are a superstar. You are a superstar. I really appreciate you coming on and talking to me. And this video is going out for World Sepsis Day and as part of the month of September in 2020 as well, which is cool. But no, thank you. And anyone who wants to find out where Laura is, you've got all of her details there, and I will put them in the notes down in below or wherever it goes. So thank you very, very much.
Do you know what? It's been an absolute joy. I always love like chatting to you. Well, you are my birthday buddy anyway, aren't you? So
It's true. It is true.
yeah. And next year I need to actually send you a cake, don't I?
I'll hold you to that.
Or we'll do that a few weeks later, because next year is my 40th. So Ryan's already got something sorted.
Cool. I look forward to it. You superstar. Thank you.
Cheers.